All right, so we're going to go ahead and get started. Good morning, everyone. My name is Oscar Morgan. I'm the project director for the Central East Mental Health Technology Transfer Center. We are funded by SAMHSA to provide training and technical assistance free of charge to individuals within HSS Region 3. There are 10 other centers that provide similar services. So essentially, as a network, we provide technical assistance training specifically on behavioral health, emerging issues and evidence-based practices to all states and territories. And I want to thank you for joining us today. We have a very exciting presentation by Dr. Karen Fortuna, who is the Assistant Professor of Psychiatry at Dartmouth Giselle School of Medicine. Today's topic is on the landscape of digital support for peers. And what Dr. Fortuna is going to do for us today is give us sort of a historical and evolutionary background of how this started, where we are today, and some thoughts about where we're going to go in the future. And we wanted this to be an interactive, robust discussion. So if you have any questions or comments, please put those in the chat box. We may answer them as we go along. We may wait to the end, but in any way, get your questions in there and we'll answer them. And with that, I'm going to turn my screen off because I think you'd rather look at her than me. But if you want to turn your screens on, please do so. Do let us know where you're from if you also like to do that. And with that, Dr. Fortuna.
Great, thank you so much. I'm so happy everyone is joining us today. So if you have access to chat and if you're able to, go ahead and put in there where you're joining us from. Technology affords us some great opportunities to connect with one another across state lines and also countries. However, it also in today's day and age, it would be also nice to get understand a little bit more about who people are and be a little bit closer if we can. So I'm joining everyone from beautiful New Hampshire, where it actually just snowed yesterday. So a little bit about me is I'm an assistant professor of psychiatry up at Dartmouth College in New Hampshire, and my background is in social welfare, and I work within a school of medicine, and I work with an international group of individuals who are peer support specialists and or recovery coaches. So these are individuals with a mental health or substance use challenge who are trained and accredited to offer peer support services in their respective state. And within this group, in this international partnership that spreads all throughout the United States and also in other countries like Australia, places like Bolivia, Romania, and the UK, together we work as equal partners to develop services and products to advance the peer support workforce using different types of technologies. And so one of which I'm going to take a real deep dive in today. It's called Peer Tech. And our team has also developed a great series of products and also has a lot of grant funding as well. So if we go on to the next slide, I'll just speak to the grant funding and then dive right in. And if anyone has any questions as we go along, please just let us know. So it's great seeing a lot of folks from Virginia Beach, warm North Carolina, in North Dakota. This is great, and also Virginia. So I do offer consulting services through social wellness. If we go through the next slide, please. I also have grant-funded support through the National Institutes of Mental Health, also Patient-Centered Outcomes Research Institute, and I also have a grant from the Brain and Behavior Foundation. And with all of these studies, we have peer support specialists as our partners, helping to move these studies forward and related to developing the research questions, developing interventions, whether it's technology-based or in-person, helping us actually conduct a study, and then also in the dissemination of results. And next slide, please. All right, and you just press forward one more, please. So let's talk about the origins of peer support. And so for today, we're really going to talk about the past and what's happening now around peer support and what's going to happen in the future, which is a little bit of our now right now. So for the origins of peer support, this actually begins back in the late 18th century in France. And there was an individual there called Jean-Baptiste Poussin, who really recognized the value at this hospital you see here of employing people who had recovered and employing them as hospital staff. And the chief physician at the hospital praised this staff called peers for being gentle, honest, and humane, adverse to active cruelty, and disposed of kindness. And so what's interesting, hiring former patients at this hospital really marked a shift in the entire philosophy of mental health care. And so this is when we have this moral treatment of care. And so, throughout this time, we begin to see peer staff popping up periodically, throughout history. And this also, again, surfaced in 1965, in which we may hear now two lay counselors. And so this is called peers. And I'll talk a little bit about different, terminology for peers that were trained in specific skills, and they were successful in helping service users with mental health challenges in hospital settings. And professionals in the community mental health center were really the first among to advocate for the integration of peers into primary care settings, knowing the value of peer support not only for mental health challenges but substance use challenges as well. And here they tried to match the individual to the patient's need. If we just press one more forward. So peer support, it's generally offered in many groups and in many settings. And so this is the traditional story of peer support. And after these state hospitals actually closed, what happened is that these peer groups, so what happened, these state hospitals closed in the United States, and then people were like out there in the community, and they were like, I have no support services. What am I going to do? So people then came together to support one another, and that's where we have these informal peer support groups. And this is where we have some famous people such as Howie the Harp and others beginning to formalize this profession. And then in 1980 or so, we have SAMHSA recognizing peer support and developing the first self-help book for this. And so here you see that, where peers are offering services, we see that they're augmentative, and it could be even individually themselves, not even augmentative, in multiple settings. So psychiatric settings, primary care, which is the huge area right now where peers are being integrated into. Community settings, aging services. There's a whole new group of peer support specialists called certified older adult peer support specialists, and also in emergency room services. So within, I spoke to some kind of anecdotal types of benefits peers have to offer scientifically through the inclusion of peer support, either individually or augmentative to these clinical providers. We see peer support can support people in the community. They can promote community tenure, meaning that people stay in the community and they don't go have early nursing home placement or institutionalization. We see a decrease in mental health symptoms. We're also seeing right now, which is amazing, peer support specialists promoting self-efficacy to manage chronic diseases in addition to mental health support services as well, and also a decrease in hospitalizations and a health-related quality of life. So there's a lot of amazing benefits to this workforce, and there's some early evidence to suggest scientific evidence to suggest that by offering peer support services, peer support specialists themselves promote their own recovery as well. So it's a really exciting, bi-directional types of outcomes among peer support specialists and service users as well. And so any questions, just go ahead and put that in the chat for me. So next slide, please. Oh, and I forgot too, the peer support services in prison settings as well, or jail. And these are forensic peer support specialists. And so there's just a really interesting area of research as well. So I'll be talking to some research that is currently under review by the scientific community. And so this is the newest that is going on in digital peer support. So to define digital peer support, this is live or automated peer support services delivered through a technology media. And in March of 2020, last year in the United States, when many places throughout the country went into lockdown, what happened is that peer support specialists quickly revamped their services to offer these services digitally. So people are using smartphone apps, video conferencing, we're still working on telephonic peer support for some places. And what's really fascinating about this is that other fields of study, so social work, psychology, psychiatry, they've had decades of training in telehealth. There's formal classes at universities in telehealth. There's international accreditation agencies. For peer support specialists, nothing existed. Yet they were able to quickly, over a period of, we say anecdotally, because we met one organization that really shut down for 3 days, and then they reopened after 3 days, offering a whole new slew of services using HIPAA compliant types of features for this. And this is actually where one of our certifications came about, and that we have a digital peer support certification that is now being used by 3,000 peer support specialists across the globe in all different settings, prison settings, hospital settings, community mental health center. And here we train peer support specialists along with my colleagues who are peers themselves in privacy and confidentiality issues, which is incredibly important. What is peer support technology? How do I access this? And how do I access this for service users as well? And happy to share that. And we study that as well, and it increases an individual's capacity to use technology, which is very exciting. So here, this will soon be out in the published literature. There is a national survey that we did of peer support specialists around the United States. Included almost 500 peer support specialists and from 41 different states. And we asked them, are you trained in digital peer support? And so the majority of which, over 50%, were like, yes, I've been trained. I am certified in this specialization. And then we asked them, well, what actually types of technologies are you actually using to offer peer support services? And so of note, video conferencing based services. And so people are using things like Zoom or GoToMeeting to connect with other individuals. That was about 33% of folks. And then we have smartphone-based communication. And so this is text messaging and also telephonic peer support. And so that's about 66% of individuals were using that. And of note, text messaging is in many places around the country is a Medicaid reimbursable service. What peer support specialists are doing is they're actually text messaging peer support and offering additional advice and referral services through text messaging, which is really exciting. And then smartphone apps as well. So they're encouraging people to use smartphone apps. And so that's about 15% of folks, one of which they had mentioned was an app called Calm that promotes mindfulness. Then we see here, these are more emerging, and another one is social media. So 13%. And so here people either have private groups. Know that this is not HIPAA compliant. And so this could be from a peer-run organization. This could be to support people in between sessions. So here we have places like Facebook. People are going to Facebook to get peer support services. Right now, if you had Facebook, and if you do, you can go on and type in parenting group, and you'll see that there's large peer support groups for parenting. So about 13% are using that. And this is really interesting because with so many people on Facebook, it offers a really great avenue for people to connect using low data in rural areas to connect to these types of groups. And of exciting news that we see that although it's small, we see this as a burgeoning area of digital peer support. So virtual reality, there's some really great work going on down at Vanderbilt University around using virtual reality to help people with substance use challenges. And so people will actually go into an office, and that's where the virtual reality equipment is, with a service provider. And they put on these virtual headsets, create an avatar. In there, they are exposed to certain things that may promote the use of substances. And so it could be a peer saying, hey, you want to go use these substances? So it's kind of like it's peer pressure. And then people have to respond to that. So they can practice what it feels like and then respond to that. And so they develop those skills outside of this virtual world. So they can use them in the real world. And so that's early research that's being done. We don't know if it's effective, but it's super interesting that that's where the world is going. And then next, video games. And so is anyone here joining us from the Veterans Administration? Go ahead if you are, and put that in the chat. The Veterans Administration has been amazing in using video games to connect with one another and offer peer support services. And this is reimbursable within their infrastructure. Here, groups join together within the Veterans Administration, and they will play games, and they'll come together, put on these headsets, they'll talk to one another, offer support services, and through playing the games, symptoms of PTSD actually mitigate or decrease, which is super exciting. Also, some organizations are offering, at Tuesday at 11 a.m., let's come together and we'll play video games together as some kind of a social feature for folks. And then if you listen into those conversations, people are offering support services to one another. So these are kind of more the burgeoning areas of peer support. And back in March 2020, last year, no one was really talking about virtual reality and video games. And so these are the new areas. Next slide, please. And any questions, let me know. Go ahead, put that in the chat. So I'm going to take a deep dive into a smartphone app that is available on both systems, iPhone and Android. It's called PeerTech. And I'm going to talk about, one, how people can access PeerTech. I'm also going to talk about how PeerTech was developed with peer support specialists as partners. And I'm also going to speak to the evidence around this program as well. If you don't mind going forward, please. All right, so you can see this slide here. There's something called human factors, and people may be familiar with this, but for those who aren't, human factors is something within the field of engineering, and it's really how a human interacts with a technology system. And because of certain factors, they choose to use a system or not use a system. So for example, someone with ALS, maybe there is a computer that is in front of them, and they're experiencing paralysis. And because of a human factor, because they experience paralysis, it makes it very difficult for them to type. So that would discourage someone from actually using that type of system. So that's a human factor. And then so engineers work with people, for example, with ALS, and they develop certain types of technology that can read their eyes. And by moving their eyes in certain ways, the technology can actually interact with the person. So these are these really important human factors. And so peer support specialists have specific human factors as well, when they will choose to engage with technology or not. And what's really interesting is that digital technology has been created. It's available. People can go to the App Store right now and download apps. But after about 2 weeks, people generally, people who have a lived experience of a mental health challenge, they stop using the app. And that's in the scientific evidence. And so what happens is that scientists and industry, they're spending billions of dollars developing these technologies. And no one's actually going to use it after 2 weeks. And so how can we get people to use these technologies? So one of which is by including a peer support specialist as someone, as a live human being that's actually going to facilitate training people how to use the technology. Maybe they're going to be text messaging in the technology. Maybe they're going to be calling a person. So that's kind of some of the human factors. And then the other ones are around building the technology. And so there's some technologies out there that may not be aligned with the values and principles of peer support specialists. Similar to other fields of study like psychiatry, social work, we all have ethics, we all have values, we all have our code of ethics, right? And so some of the technologies may not align with our personal or our respective field of study or practice code of ethics. So some of these technologies may be monitoring what people are doing in their geographic location, where they are. They could be monitoring your voice. So there's a lot of things that could be happening in the technology. They could be taking data and selling it to people. So in developing technologies, we work with peer support specialists as equal partners, and we actually measure that partnership, because I could say all day, oh, it's an equal partnership. And then you can ask people on their team, they're like, that's not an equal partnership at all, Karen. So we actually have tools in place to measure that. And we work with peers as partners. And so here is the process that our team does. And this is related to all of the really great trainings that we develop and also the technology tools. So here there's preliminary research before the community engagement. And so this is really understanding the state of the evidence from the researcher's perspective and non-peer researcher's perspective. And then defining the problem from the peer's perspective. And so what does that look like? So maybe doing an online survey, maybe talking to peer support specialists. What is the problem around technology? And then here we understand capacity building. What does a researcher bring to the table, non-peer? And then what does a peer support specialist bring to the table? What are their assets? What are their strengths? And then here we incorporated consultation. So establishing relationship and developing trust with the group. But no, too, this has been a process of about 6+ years now. And so these types of work does take a while. And here, our team, as a scientific team, not including any peers, we developed the first iteration of peer tech. And when we brought it to peer support specialist, it was highly medicalized, and peer support specialist said to us, there's no way I'm going to be offering this. You need to make these changes. And so here we began working with peer support specialists in this full partnership, making changes to the content of the actual technology. So there's a library in there, which I'll speak to. And so making it focused on recovery language, not only working towards addressing mental health, physical health, but also helping people or working with people to address social health as well, and potential traumas that people have experienced. And this was from the peer perspective. And so it really advanced the actual program. Here we also developed this infrastructure as well. And so we have formal meetings, which are really fun. And although they're formal, we have fun during them. And peer support specialists work as partners on all of our projects. And this is when we incorporate these measures of accountability. Because again, I could be saying that, oh yeah, this is a great partnership, but it's really important that we actually have some measures of accountability in there. And then research capacity building. So I get training, and my team of scientists and students that we work with, training on terminology, procedures, how to work collaboratively, what really is shared decision making. And then we have a training we're developing with peer support specialists as partners in how to be partners in research, how to work with scientists on these teams, working with us to publish, which is really exciting. And then next we have co-learning. So we both learn from one another, of course. And then you have this iterative design process. Things happen over time. And then the long-term collaboration. Each year, we probably publish 22 scientific review articles together. We have a website. We have multiple grant applications out there to make this sustainable and enjoyable for people as well. So these are all the human factors and how things are developed. You mind going to the next slide, please? All right. And so in doing this, we learned that, we need to make this at a fourth grade reading level, limit compound sentences, promote repetition. Repetition is really important because to develop mastery of new skills, if we repeat things over a period of time, it's kind of like, oh, wait, yeah, that's important. I remember that. And so it's just a way to offset memory challenges potentially. We also have on-demand videos. We reduce hyperlinks because that is not aligned with evidence-based design features for this group, limiting color contrast. And by doing so, it actually jumps out at individuals. So people with vision challenges. And then I spoke to incorporating trauma-informed principles. We excluded passive tracking, meaning that the phone could be tracking voice or your geographic location. We didn't include that because it wasn't aligned with the values and principles. And then, of course, the technology selection and analytical techniques. And so the app is available on tablets and also phones as well. And so next slide, please. All right, and so in working with this team, here's what we have. And this is the peer tech classes. And here, individuals, the program is designed to address one of the major challenges among service users is that it's early mortality. So people with a mental health challenge for decades now, and millions of dollars that has been spent to try to address this, people die up to 32 years earlier than the general population. And so this is the problem that we wanted to address with one another. And we developed this intervention or program, peer supported, to address that challenge. And so we know that health behaviors is the main reason, according to scientific evidence, while people are dying early. And so that's not getting enough sleep, that's living a sedentary lifestyle, that's not exercising. Well, in talking to peer support specialists, they were like, Karen, no, it's actually loneliness and social isolation. That's why people are dying early. So we included a lot of work in there around developing and maintaining friendships and addressing social isolation as well. For the first time in history, this type of program is out there, and hopefully, and you'll see how we are getting some results from this. So go to the next slide and I'll walk you through what peer tech actually looks like. And within this, you see on the left-hand side here, and excuse the medicalized language, commonly work with medical doctors, and so I have to be able to speak to them. So anyway, this slide uses terms like patient, but I'll speak to it as a service user. And so here's how it works. And peer support specialist will meet with the service user for 1 hour each week over a 12-week period. And they could meet, it was originally in person, but now they can meet over the video on the actual phone, or they can offer telephonic peer support as well. And within that, they go through those classes one-on-one with the individual. And in between those sessions, That's when a peer support specialist and service users, they text message back and forth. They promote, maintaining their recovery. They promote working towards those goals in between that session. We know that mental health challenges don't happen at 11 a.m. on a Tuesday, during a scheduled appointment. No, it's when people are actually out there in the community. And this is where peer support specialists and this text messaging feature in between those sessions has been extremely helpful for individuals. And it's actually, we're seeing that we're able to increase the impact of peer support services without additional in-person sessions because of that text messaging feature, which is super exciting. And so if you're joining us from a medical system where people are charged for every in-person visit, it's very exciting that people could be in the community but still be supporting themselves. And we use the app to facilitate that. And we train peers in the actual program. So here, there's a HIPAA compliant text and video chat that's assigned to peer support specialists and service users. Peer support specialists have access to this resource library as well around those classes that I spoke to. And then there's notifications to reach out to a service user if they're reporting they're not feeling well, if they're feeling lonely. And they also can schedule their work hours, which is great. So if you get a text at 3 a.m. on a Saturday and you are not working, the service user gets an automated message that, oh yeah, I'm not working at this time. If it's an emergency, please call this number instead. And then next, peer support or service users, they have access to personalized goal setting. They have their own wellness plan, which could also be called a psychiatric relapse prevention plan. They have daily task lists that they develop to stay well. So go for a walk for 10 minutes a day, cook a healthy meal, those types of things. And then a resource library as well with text and video. And then surveys we ask them to fill out around feelings of loneliness or distress. And then here, we're actually studying this in many places right now. We have a study going on in Norway. We have a study in Kentucky, in Tennessee as well. We also have a study in Boston, Massachusetts. So there's a lot of different studies going on, and each group gets their own actual system. So it's really practical for organizations. And if you head out to the next slide, I'll show you some of the really cool results. So far, we've conducted 2 studies with this. And this is really exciting. And so this first study was with 8 individuals, and this included certified older adult peer support specialists. So these folks are individuals aged 50 years or older, have a lived experience of aging with a mental health challenge, and they have their certified peer support specialist training or the recovery coach training, and they have a specialization in working with older adults, which is super exciting. So anyway, so you look at the age range, the mean age, so the average age of people that were receiving services were 68 years old, and the range of receiving services was people aged 62 to 77, and they have the app. So that's super exciting. And then you go to the next slide, please. So we train folks in how to use the app and whatnot. And then peer support specialist, a part of this group, they were certified older adult peer support specialist, and they were all 55 years or older. Majority were female and identified as white. And next slide, please. And the peer training, which has now become this international training, is generally over 4 days. And we talk about privacy and confidentiality, digital communication skills, digital fatigue, how to address a crisis. In addition to that, we also have training on the actual peer tech system. And here we incorporate adult learning theory to promote uptake of learning. And we do not require people, peer support specialists, have access to technology or know how to use technology. We just want people who are willing to use technology. And that has worked very well for our team. And next slide, please. Cool. So the results. Okay, all right, Karen's talked all about this, well, what actually happens, So after this 12-week program, we see that peer tech is, this is a single arm pre-post trial. If I have any scientists or others joining me familiar with study designs, we see there's actually an increase in a person's ability to manage their medical conditions. There's a statistically significant increase in a person's ability to manage psychiatric conditions, an increase in quality of life, hope, self-efficacy, which is confidence to manage these conditions. So what's interesting is the confidence or self-efficacy is such an important variable, because if, for example, someone was smoking cigarettes and they had a low level of confidence that they could quit smoking cigarettes, what's the likelihood that they'll actually quit, right? But if you have a high level of confidence, if you just focus in on that confidence, what's the likelihood they're going to quit? So it's a lot higher. So self-efficacy is this really, really important tool and variable. Also increase in social support and empowerment. If you're reading this, it says empowerment is actually going lower, but that's just how the scales develop. So if you have lower scores, you have higher levels of empowerment. And this is a small sample, so we were excited to see some things that were statistically significant. All of these things are things that could help extend a person's lifespan, which is super exciting. Next slide, please. All right, and so we'd actually just completed another study with a larger sample, so a larger group. So we have 21 that actually completed this study. Majority of people reported a diagnosis of schizophrenia spectrum disorder, bipolar disorder, or major depressive disorder. Next slide, please. Here we identified peer support specialists, not certified older adult peer support specialists, and we trained them with our training that we have. Next slide, please. And the training got really intensive. And this is I'll just walk us through what this is, but here's the scientific manuscript about how our training works. And so does anyone go to a training or a lecture and we'll make it something like, learning how to surf, okay? Since summer is coming upon us. And they go to this training and lecture about learning how to surf, and they watch over a video conference, and then they actually go out to the beach and they get in the water and they realize that, well, maybe the training on learning how to surf, it wasn't as effective because they're actually out there and doing it themselves without additional support services. And so that's commonly similar when we learn new skills. And so when we have an educational setting, going out there in the world and actually doing it and having the experience of it is how we can promote learning. And so learning is really a process. It's not a 4-hour seminar. It's not, going onto YouTube and watching a 1-hour video. It can get you a certain place. It really can. But then going out there in the world and having that experience, that's where people really learn. And so that's experiential learning theory. So from that, we have this longer process to teach people around digital peer support. And so there's an education and simulation training. And so this is for 2 consecutive days, 16 hours. In here, people come together, learn all the great stuff about digital peer support. They learn digital communication skills, digital literacy, digital peer support technologies, digital policies and compliance, digital crisis intervention, and privacy and confidentiality. And then we have people go out there in the world. And then we do an audit and a feedback in a very supportive way. So we monitor and look at the technology with people's permission, of course. And then we give them feedback. Oh, hey, you're doing this great. Oh, hey, maybe we can see some improvement here. And this is in a group setting. And then next, and after that first session of audit and feedback at 1 month, we saw a huge uptick in people's ability to use technology. It was amazing. And then we did audit and feedback again, and it was even a larger uptick. And so this is called the supportive management structure in learning. And so this is the process that we have developed from our work with PeerTech. Next slide, please. And this is available for everyone if anyone's interested in learning how to train with others and how to use technology. Okay, so this is a really complex slide. So let's just go to the next one and I'll show you where we found improvements. Thank you. So after the delivery of peer tech, after we made additional adaptations, we once again see statistically significant changes in empowerment among service users. SHRAPS is actually a person's ability to manage medical conditions. And then of interest too, and press it forward one more. Oh, actually, I'm sorry, go back one. So those red arrows are where we saw statistically significant improvements, just means there's a stronger level of evidence. And the underlines are where we saw improvements, non-statistically significant, and which means like it isn't, because it's such a small sample, we report on improvements as well. So if we had a larger sample, these would likely be statistically significant. So we saw increases in hope, a person's ability to self-efficacy, and also a person's ability to manage psychiatric challenges, and also health-related quality of life. And next slide, please. And what was interesting too, just fascinating about this, is that we actually collected this data in March of 2020 of last year, where there was, the beginning of the pandemic and the beginning of the lockdown for individuals. And so it was interesting because we saw that loneliness actually, because we're really interested in that as a team, because loneliness is related to early mortality, and the service users we have worked with, they have indicated that they think loneliness is one of the main reasons that people die early. And so we want to really tap into that. It actually stayed the same. And so we think that because we collected that data when people were going into lockdown, that's probably why the loneliness levels generally stayed the same. And so we actually don't know. So we'll do more studies on that. And also social support stayed the same throughout. But again, we collect that data when people were just going into lockdown. So what does the future of digital peer support look like? So go ahead in that chat and let me know what you think the digital future of digital peer support looks like from all over the country. We have some folks from Virginia, Delaware, Maryland, North Dakota. What does it look like in your respective areas? Is it something new? Is it something that is just taking over? Just curious what people are thinking. And so within our team, what we're seeing scientifically is that we're seeing more and more apps that are out there and available to offer peer support services. And so you can actually, we actually have a database of those apps on our website that you can go to, and all the scientific evidence too. And these apps you can access for free or very low cost, and it's a way to deliver peer support services. Maybe it doesn't have to be as structured as something like in Peer Tech, but this is really the facilitator of the human connection. Here we have apps we've added in around Veterans Administration, other apps that promote mindfulness meditation for folks. And there's a whole slew of scientific research as well, and also information on Peer Tech too. So smartphone apps, something that people carry with them every day. Or smartphones, if they do have a smartphone. If not, people have cell phones too. So within that, we see smartphones as one way. Also, never forget the telephone too. We're working with people that may have lower technology adoption rates, and they may just choose to not want to connect over video conference. They may prefer to choose to connect with people over the telephone. And so it's just something to take into consideration as well if you're building out programs, because we will still see telephonic peer support because it does have such an important role in facilitating the human connection for individuals. Anecdotally, actually not anecdotally, we looked at the scientific evidence around if there were any variations on age related to people using video conferencing, telephones, virtual reality, video games, And we found the only difference on age was actually for video conferences. Older adults prefer to use video conferences, while everyone else uses different types of tools to connect. Now, anecdotally, we are hearing that younger adults prefer to connect through text messaging, and older adults not as much, potentially due to age-related changes to a person's dexterity or their ability to type. Also, too, video games is a whole area of research that could be a mechanism to offer peer support, and also some types of evidence-based practices as well, considering the amazing work that the Veterans Administration is doing around this for the veterans. And also there's peer-run organizations around the world that are integrating video games right now to support and connect one another, where we're hearing that we're actually reaching people, we're engaging with people through video games. And then here on the bottom, we see some, avatars and peer bots, which is a chat bot, is another one as well. We're not sure how far these avatars or virtual reality work will go, but there's some research in that area of interest. These are more costly types of tools for people, and so it may have to be and people may not have access to virtual reality as well due to potential costs. And so this may be something where you go into an organization, maybe peer-run organization or not, and you engage in virtual reality in those locations potentially. And then also chat bots. And so this is highly controversial. So I will preface it with that, in that if you go onto a website now, you could type in, they'll ask you, there's one, they'll ask you, what are you here for? How can I help you? It's a little chat feature in the right-hand corner generally the right-hand corner of some websites, right? And so you're like, oh, I'm here for car insurance or something along those lines, And on the other end of that, it could be a live human being, or it could be something called a chat bot that's actually picking up your language because you said car insurance. And then it has this whole script on the back end about how to, sell you car insurance, but you're really talking to a robot the whole time, right? So there's some early work being done for peer support in this area as well. Controversial though, please know. And the warmth and empathy and lived experience of a peer support specialist is really powerful in supporting people outside of traditional psychiatric services, and really promotes this community based services in between sessions. So it is so powerful. So people are actually trying to create computer algorithms to replicate the warmth and empathy and lived experience of a peer support specialist in these chatbots. So this is a fascinating area of research, highly controversial and of interest. It is unknown if people will engage with these types of technologies. Potentially it has some place in the service continuum. Potentially it does not. We've been talking with peer support specialists around the world, which is really exciting because there's different histories and philosophies in different places, from Romania to Australia to North Dakota, we'll say, or Delaware, right? And we're hearing that a chatbot couldn't actually get at the person in their environment and all the things going on around them. And so it may not be as effective. But if somebody needed some support, crisis support, to get in touch with someone and then referred, maybe it has a place there. And so that's what we're hearing in the world. And also too, I did want to speak to some of the things that are happening around in developing technologies to support access. And so there's some new work coming out very soon around best practices in developing technologies. And so for health equity. And so this does include people with mental health challenges, knowing that there's a very large health disparity related to a 32-year earlier death than the general population. That is one of the largest unrecognized health disparities. And so within this, there's some best practices that are being put out there for mobile health development for health equity. One of which is designing it in a way that people can understand and use, and also that it's aligned with their values and principles. Also incorporating 508 compliance. And so what that means is that if people have vision challenges or hearing challenges, that there will be services in place within the technologies that they can still access those technologies. Some other things are around some of those human factors. So has anyone ever looked at a privacy statement in the App Store or Google Play? And it was like, what the heck does that even mean? So advocating for having these statements in plain language so you will be truly informed about what this technology is. And you can also inform service users about what this technology is as well. And also capacity to turn off some elements of the technologies. And so, for example, if the role of peer support specialist is not around medication adherence, which historically that is not something that a peer support specialist would work with someone on, having the option to turn off those elements for people really can offer choice. And then having it accessible on different types of programs. So not only having accessible on a smartphone, but also a tablet, because that may be the preference. And some of our research suggests that peer support specialists prefer tablets. And then also we find that certified older adult peer support specialists prefer tablets than smartphones, possibly due to the size of the screen. And then accessibility without the internet, which is really important, because what about someone in a super rural area? And so I live in northern New Hampshire in the mountains. I am thankful my internet is working today. We also have electricity. So these things matter to people, so making sure some of the tools are actually accessible without having access to the internet or even developing those technologies. And in the developing the backend, you could say, yes, use lots of data and run at this amazing speed. But you know what? You can also set it, use only this amount of data. So for people who are on SafeLink plans, which is a Medicaid reimbursable service to get free smartphones and data plans for people, service users have told us, I don't have enough data. They don't give a lot of data. The minimum requirement is for data is pretty low. And our team is working to hopefully work to change that, but creating apps that only use minimal data standards and develop it so it doesn't use a lot of data. So next slide, please. Okay, so here's where, we talk about, this is really around this health equity. And so when we develop these programs with peer support specialists as partners, it's one of which is that it's really, really fun work. And one of the reasons I love my job and what I do. And within that, there's also amazing research benefits. Like you actually develop something that people want to use. So rather than what happens is that people develop scientific programs, right? And then they put it in their bookcase, and it actually sits there, and it never gets used, and so it actually takes 17 years from the development of an intervention to actually when it gets into practice. Okay, but if we work with peer support specialists and others who actually use the program or services or receive the program, you actually have really amazing benefits because it creates it for that specific group. And then the uptake is much, much lower. It doesn't take 17 years. Our team has seen about a year actually, which has been really exciting. And of course there's implementation benefits in that some of our programs now around certified older adult peer support specialists is now a Medicaid reimbursable in a few states right now too. So there's amazing implementation benefits. So I gave a lot of information. So we'll just go to the next slide and then we can work to answer some questions together. Oh, and final slide too. This is around achieving health equity and some best practices for design, which I definitely spoke to throughout all of this. And of interest, we were talking about yesterday with the team, which is quite fascinating. And that, so when we develop these technologies, you incorporate, when you develop them, there's a whole life cycle of development. And so it could take, a year to actually develop an app, right? And to do that, you incorporate, our team incorporates system engineering and feedback from end users, right? So there was one example in a program that was out there. Has anyone heard of My Pokemon Go before? Go ahead in the chat and let us know. And if not, this was an app that was developed where it uses augmented reality. And so you download this app and you like hold up your phone and I guess you go find Pokemon. And we thought, oh, this is great. It's going to get people walking, it'll be a great exercise tool. Well, it was for a little while until all over Twitter, there was this posting, My Pokey Hood. So here, you can look it up. My Pokey Hood. Go ahead and you can look that up on Twitter. Just put in a Google search if you have access to the internet. And here, what happens is that people in the south side of Chicago, they held up their phone looking for these Pokemon, right? And there was none. There was none in the south side of Chicago. And then they found this in multiple urban locations throughout the United States. So Philadelphia didn't have any Pokemon, or, I don't know, like more urban areas in New York City, didn't have Pokemon. And so what happened was when they were doing their systems engineering, they used algorithms that were easily accessible to the engineers, which is, that's, it's efficiency. And they used places from really wealthy areas. And so that's where the Pokemon were. And so it did create this health disparity in a way, because I live in the south side of Chicago and I can't play Pokemon, right? So this also happens too in development around, we talked about this yesterday, around smartphone watches. And there's a certain light that is used around heartbeat, right? And within that, it actually bounces off your skin to give you an accurate reading of heart rate. And what's interesting is that the pigmentation of your skin actually impacts that response. So it could say, so based on the color of the pigmentation of your skin, you might get a different reading, even though your heart rate is the same. And again, this is actually due to that one light that is used is actually lower cost. And so, how do we create health equity around that? And so when I spoke to how we develop these tools with people or the community of interest as our partners, that's one way that we can offset those types of things. So we'll just pass on to the conclusion and go to the next slide, please. Thank you very much. And we could answer some questions and then talk about how to get access to some of these really great tools. Thank you, everyone.
Thank you, Dr. Fortuna, for your presentation, and we really appreciate that. If you have any questions, we'll take questions for a few minutes before closing out the session. Please put those into the chat box. In the meantime, Dr. Fortuna, can you discuss a little bit more about accessibility? How does one get these apps? And the other question that comes up a lot is, are they free?
Sure, that's great. Okay, just making a note of that.
And can you put the slide in the meantime of health equity back up for Victoria?
Yeah, it's actually a really cool article. It's called Achieving Health Equity, Back to the Future. It's got the coolest title for Victoria and others on that. Yeah, if you just go back that one slide. Yep, right there. So happy to share that with folks. It's really interesting. And so many of these apps you can access for free. You can go to the App Store. You can go to Google Play. You can also go to our website, digitalpeersupport.org. We have a whole repository where you can search for an app. You can type in peer support and a bunch of peer support apps come up, or mindfulness apps as well. And so accessibility is really important, and some of the features may not be in the apps. So please keep that in mind, because as people are developing this, we talk about health equity around, my Pokemon Go or the smartwatches. But what about, health equity around people who maybe have dexterity challenges, vision challenges, hearing challenges as well? And so these are the 508 compliant apps. And so what you can do, if there is an app that you're really interested in using, such as Calm, which is one of the ones we found in our study that peers use, you can actually go onto your smartphone, whether it's an Android or an Apple, and you can open up settings, and you can open up open up the accessibility options in the settings. And there you'll see that you can make the text larger. You may have an option for voice to text. As well. And so it's a whole really interesting area of work that people are engaging in. In that other article that I spoke to about best practices in developing, we're working with engineers and scientists and peer support specialists, of course, and service users to hopefully get that out in the next month. And so that could be something that people can build off of. And then, of course, Pure Tech, that system is of interest. And so we work with organizations, and we give people the digital peer support training and access to the actual app within their respective organization. And some future work happening in that as well is that people who are maybe wanting to use this for themselves, or maybe service users outside of the organization, we're going to have it to a point where you could access Peer Tech and then go into some informal types of peer support groups, and then potentially, when working with a large organization, have more access to that one-on-one support for folks. And also too, these apps and all these other technologies are great, but I also want to say too, never forget the telephone. With our team and the work we do, technology is just the facilitator of the human connection. So if someone is in rural North Dakota and in need of some additional support, the telephone, maybe we don't have to use virtual reality to connect with them, but we still connect with them through the telephone. And also one more thing too, which is really exciting. So there's a federal law set in place that allowed for the State Assistive Technology Act. And so every state, from North Dakota to North Carolina to Maryland, they all have this access to the State Facility Technology Act. And within your respective state, there is an organization that offers loans for technology demos, or you can purchase technology that has been refurbished at a very low cost as well. So just thinking about accessibility, and I will put that in the chat.
Thank you. Another question is there any work being done in this area in the addictions field?
A lot of work's being done in the area of the addiction field. And so there's some great researchers out there. Robert Ashland is one of them, who's doing some really amazing work in the addictions field. There's some other programs around Marigold, which is a digital peer support platform for opioid use challenges. It's peer supported. And Robert Ashland's work has this whole systematic review, so all the research in the world on addiction and peer support services. And so we can send that article to you, because that's really, really great and exciting. What's interesting is that when mental health fields developed, you have mental health services, then you have substance use services, and then we finally get this integration of the two services. So as that question was asked as well, I wonder if that's what's happening in technology, because there hasn't been that integration just yet of co-occurring challenges around mental health and substance use. And so that's a great question. And I haven't seen much around both of these types of areas. I will put that in the chat as well, that other article.
And while you do that, we've talked a lot about the positive aspects of telehealth when it comes to peers. Are there any things, any stop signs that we should be concerned about? And maybe that's not fair to ask you but just wanted to know.
I think it is fair. It is so fair to ask me that. And I so appreciate that as well. Because I personally don't want to see a replication of things that have happened in the field of mental health in the past, but we're just doing that. And now it's just being replicated in technology. So for example, some technology is being used, it's around motion mapping or Bluetooth technology. So here, you're in an inpatient unit and people are actually mapping where you're going and they could see where you're going. This is literally has been used with mice before to see where mice are going, right? And here they're developing predictive algorithms to see if there's any behavioral disturbances. And in talking to peer support specialists and service users, yes, there could be some benefit for this. However, for others, that might be a really high level of monitoring and potentially unnecessary and potentially perceived as a non-trauma informed approach for individuals. And these are on inpatient units. And so, so technology is very, very powerful, and it needs to be within particular parameters that, you know, a non-trauma informed system, we don't want to go back to that. And so within that, that's why digital literacy is so incredibly important. So understanding what's happening in motion mapping, so you can make a choice if you want to engage with this or not. Or other technologies like digital phenotyping. Here, it's a smartwatch or an app that they're collecting all sorts of data from you and making decisions around, you know, changing medication, about intervention, about, you know, sending police officers to people's doors. Like these are the decisions these technology algorithms are making, while they could have some amazing benefit for people. It needs to be a system that is incredibly informed. So before people choose to engage with those technologies, people are offered the choice, and they're offered the choice in a way that is accessible to the individual, like it's digestible. Because you can look at some of the privacy statements and you're like, what the heck does that mean? You know what I mean? Or even some informed consent stuff and research. So making sure it's supportive of people and their choice. And yeah, and I think it could potentially save lives. So there is some benefit, but the importance of having informed decision on that as well. And in addition as well, let's talk about digital fatigue too, which people may have been experiencing in the past year if you are using a lot of these technologies yourself. So what's great is that technology can increase the reach of your services, right? But it also could be creating feelings of digital fatigue as well, and leading to burnout as well, because people are potentially going from one meeting to the next, to the next, to the next, to the next. And so having some parameters around that. In some organizations, what they're doing is that they're only booking meetings for 45 minutes. Other organizations are allowing people to bill for self-care. And so, so that's some of the other challenges that on a macro level, people are working to address.
Thank you. One more question, then we'll close out. There's been discussions about age appropriateness in terms of, you know, a cell phone. You know, is that something you give a 6-year-old, a 5-year-old? Some people say you give it because of security purposes and be able to reach home. Others are, you know, well, it's there, give it to them. Are there any discussions around age appropriateness when it comes to the use of technology such as this?
Well, that is interesting. And my guess is that there has been some considerations around this. Our team works with adults and older adults. And it's an interesting scientific question that I don't have the answer to. But I can look into it because it hasn't been considered by our team, because it could lead to, you know, using these technologies really just changing the brain of an individual.
Right, and that's where I was coming from, because I've done a little dabbling, and there's studies on ADHD that says if children play games, that it exercises the brain, and that when you exercise the brain, you may be able to overcome some issues. So children who are nonverbal may be able to be verbal to some extent. And, you know, it's all part of the therapy, but I was just wondering if that has been an area of consideration. But we'll have to keep looking forward to more.
And it sounds like it could be a potentially new area of consideration as well. What's really fascinating about this field is that although it has been around within the scientific community around outside of warm lines since 2005, it's still a really early area of research. And so I think you just brought upon a really interesting question that will be explored likely in the near future.
Okay, well, we're almost to the end. Do we have any one final question? If not, I want to thank each and every one of you for participating in today's webinar. And of course, always thanks to Dr. Fortuna, who's, to use a word that's probably been used too much, on the cutting edge, and really pushing the space where peer specialists and peers in general can use technology to help support their recovery. And we appreciate you for your passion and for your skills and for bringing this information to us. And if anyone has any questions or comments, please feel free to reach out to Dr. Fortuna. She's very accessible. And even without the modern technology, she'll get back to you some way, somehow.
That's right. That's right.
So we appreciate you very much, and
Yeah.
appreciate everyone who's on the call, on the webinar today, and have a great day and enjoy the conference.
Wonderful. Thank you, everyone.
Thank you to our
Appreciate it.
tech person too. Thank you very much.
Thank you.
Tech guy. Thank you.